Welcome everyone. So now we are going to look at vasculitis, which is inflammation of blood vessels. As we know that blood vessels are of three layers. First one is the innermost endothelial layer, middle smooth layer, and outermost tissue of connective tissue is adventitia, connective tissue adventitia. So inflammation of arterial wall resulting into vasculitis. Etiology is most commonly unknown or because of non-infectious causes. Clinical features: patient will have non-specific symptoms like inflammation, fever, fatigue, arthralgia, weight loss, and patient have some of the symptoms like organ ischemia due to luminal narrowing and inflammatory vasculitis. So it is divided into three types based on the size of vessels. One is large vessels vasculitis, and it is most commonly involved in aorta and other branches. Another one is medium vessel vasculitis in muscular arteries that supply organs, and last one is small vessel vasculitis, which is in arterioles, capillaries, and venules. So these are three types of vasculitis. Now we will be looking at all of these types one by one. Okay, so now we are going to look at the first type of vasculitis, which is giant cell vasculitis or large cell vasculitis. It is giant cell vasculitis or arteritis, in which granulomatous vasculitis is there. Most common form of vasculitis in older patients whose age is more than 50 years. It is present with a headache. Patient will have headache. Patient will have visual disturbance, and ophthalmic artery involvement results into visual disturbance, jaw claudication, or flu-like symptoms, or polymyalgia rheumatica, often present with ESR elevated. ESR will be increased in the patient of giant cell arteritis vasculitis. And biopsy reveals inflammation of vessels and intimal fibrosis, or there is lesions of segments, and the biopsy will be also excluded in the patient having a negative biopsy. So treatment is corticosteroids, and there may be high risk of blindness if treatment is not done in giant cell arteritis or ophthalmic artery arteritis. So corticosteroid can also limit the progress of disease. Another one is it is present if it is present in adults less than 50 years of age. Visual and neurological symptoms are there, with a weak or absent pulse in upper extremities, and treatment is also corticosteroids in giant cell arteritis. Another type is medium cell vasculitis, in which polyarteritis nodosa is also there, in which renal artery is also involved with some neurological symptoms like visual disturbance and skin lesions as well. Now the types involved in medium-sized vasculitis are Kawasaki disease and Burger disease. In Kawasaki disease, there is mucocutaneous lymph node enlarged with cervical lymph nodes. Enlargement will be there, coronary artery involvement, and there is also aneurysm with rupture. Its treatment is IV IgG. IgG immunoglobules are given in IV form, so Kawasaki disease can be treated. And the Burger disease is also known as necrotizing vasculitis, involving in digits and the limbs, present with ulceration, gangrene, and auto amputation of fingers and toes. Raynaud phenomena will be there. Peripheral vasodilation results into decrease or bluish discoloration of limbs, and it is associated with heavy smoking or sudden smoke cessation with treatment. Patient present with Burger disease. This one is a medium vessels. And the last type is small cell vasculitis, in which there is vaginal granulomatosis, microscopic polyangiitis, Churg-Strauss syndrome, and Henold-Chennault purpura, the last one. Now, vaginal granulomatosis, there is involvement of nasopharynx, lungs, and kidneys. Classic presentation in middle-aged patient with sinusitis and nasopharyngeal ulceration with hemoptysis, and bilateral nodular infiltration will be there. So patient will have involvement in lungs, sinuses. Patient will have involvement in lungs, sinuses, and biopsy reveal large necrotizing granuloma with adjacent necrosing vasculitis. Treatment is cyclophosphamide Steroids are common. And the microscopic polyangiitis is also small vessel vasculitis in which there are multiple organs are involved like lungs and kidneys with serum PA and CA positive, and the treatment is corticosteroid with cyclophosphamide. Last one is Churg-Strauss syndrome. It is necrotizing granulomatous inflammatory disease with asthma. Patient will have eosinophilia and serum PNK level will be increased in this vasculitis. So these are the types of vasculitis. In the next video, we will look for hypertension and its types.